Well, good morning, Excellencies, colleagues, Coalition and Task Force. Thank you for this opportunity. So the division of the United States Centers for Disease Control and Prevention works around the globe to advance efforts to achieve global goals for viral hepatitis elimination. In the United States, CDC provides leadership in science and public health practices to prevent and control viral hepatitis. And some of the examples of the number of ways we work include monitoring viral hepatitis disease trends, as evidenced by the publication of national viral hepatitis surveillance reports annually, prevalence estimates for both the general population and key populations, and national viral hepatitis care cascades. We also support state, local, and territorial entities through direct financial support as well as technical assistance, equipping them to detect and respond to viral hepatitis outbreaks and conduct viral hepatitis surveillance, elimination planning, and service delivery. We also develop and promote national viral hepatitis testing and vaccination recommendations, which include recently updated universal Hep B and screening recommendations among all adults, universal Hep B vaccination recommendations for all adults 19 to 59 years of age, and that builds upon more than 30 years of successful vaccination recommendations among newborns, infants, and adolescents. And we recently released newly developed testing recommendations for infants perinatally exposed to hepatitis C. And additionally, we work to increase viral hepatitis awareness publicly through the development of peer-reviewed publications, maintenance of our CDC web pages, and also providing direct support for community-based coalitions and online training platforms for healthcare providers. Globally, the Division of Viral Hepatitis at the U.S. CDC is a World Health Organization collaborating center for reference and research on viral hepatitis, providing support for development of viral hepatitis guidelines on the global, regional, and country levels, and also working with countries to advance viral hepatitis elimination through collaboration and provision of technical expertise. And a few specifics are working with countries and partners to develop and implement viral hepatitis serosurveys to estimate the burden of viral hepatitis at the country level. So specifically in the sub-Saharan African region, which has lacked information representative of the burden of disease in the general population, we've worked with several countries to implement either new viral hepatitis serosurveys or to test specimens that are collected from HIV serosurveys. And these results are being used to guide the development of national strategic plans, inform vaccine development or vaccine policy, and also guide screening and treatment strategies. CDC is also quite invested in Eastern Europe and Central Asia region, where nationwide hepatitis serosurveys were implemented in Georgia, Uzbekistan, and Kyrgyzstan. Based on the country data and the context, the development of national strategic plans takes place, and most recently, CDC has worked with WHO and partners in Pakistan in developing their national strategic plan for viral hepatitis. And we also work to support countries as they scale implementation for prevention, diagnosis, and treatment, and strengthening laboratory capacity. And this includes supporting with the introduction of birth dose vaccination, and more recently, CDC is supporting Pakistan, Uzbekistan, and Moldova with scaling up screening and treatment for viral hepatitis. And finally, CDC supports countries to document their success and the impact of their viral hepatitis program activities by compiling the evidence needed for validation of viral hepatitis elimination. So in closing, I'd like to thank you very much for this opportunity to highlight some of the ways that the U.S. CDC is working globally to advance elimination goals. Thank you.